Hey there, thanks for taking the time. Dr. Barry Reed, Mason Spine and Injury Center here in the greater Cincinnati area. I met a gentleman this weekend who was describing the difficulty that his wife has had after having 2 children. And what he said made total sense, that before either one of the pregnancies, her back never bothered her, her hips never bothered her, she was in great shape, she exercised, she was a runner, and that during the first pregnancy, she noticed that one of her hips, her right hip, just always bothered her. It ached, it was dull, achy. She had the first child, and then during the second pregnancy, this low back or hip pain became more prevalent, more common. It hurt worse. She couldn't sleep on that side. And then there was the birth of the second child. And unlike the birth after the first child, the second child, she believes, and he believes also, caused a permanent change in the way that her hip or her low back, or perhaps both, worked. So that made perfect sense to me. During the pregnancy process, you're growing here and your back has to move back this way, and it causes changes in what are called your sacroiliac joints, these guys here. And it can also cause changes of positioning in your low back. And so he's telling me the story about his wife, and she went to physical therapy, and it was just a guessing game as to what needed to be done. In this office, with every single patient, we do a complete history. How long have you had this? What does the pain feel like? Where is it? When it's at its worst, where does it go? Does it go into your arm? Does it go down to your fingers? Does it go into your head? Does it go down the back of your leg? Is it only right here? Is it when you take deep breaths? Does it get worse when you work? Does it get worse when you sit? Does it get better? All of those items are pieces of the puzzle that are helpful in us knowing what we need to do. Do we need to take x-rays? Do we need to take an MRI? Do we need to send you to the emergency room? Do we need to send you to an orthopedist, a neurologist, an OBGYN? What do we need to do to determine what the cause of your symptoms are? So she had common low back pain. Well, that can be caused by many, many, many things. So in her case, what needed to happen was an x-ray to see if it was one of these being out of position that was causing this to ache, or if it was the SI joint that was being locked or rolled back and had adapted to the pregnancy and never got repositioned. That's a very common occurrence. Also is very common when people have the epidural. And for those of you who have had the epidurals and then have never gotten rid of your low back pain, that's a nightmarish process. We've had great success with those types of cases. The point of this video is we make sure, if at all possible, to gather all the pieces of the puzzle that could be causing the issues, the symptoms, your pain. And then we go backtrack and we find out what the most likely thing is that could be causing it. And then we test to see if all of those pieces of the puzzle are consistent and congruent. And then we come up with a game plan. So we do a consultation, exam, we do some testing to see if our theory is plausible, reasonable, medically reasonable, and then we try to put together a plan that goes back to the cause that will help eliminate the symptoms that we have. That's the basic process. And very rarely do we work with people whose cases I believe we cannot help. We've had great success with headaches, neck pain, back pain caused by a myriad of different situations and circumstances, pregnancies, accidents, military work where you had a slip or a fall and it happened 10 years ago and your body never really got over it. Consultation, evaluation, x-rays, and review of the x-rays. If we find something wrong, we find something out of position or something that's out of balance, whether that's in your neck, in your elbow, in your shoulder, in your hip, in your knee, in your ankle, we show you the x-rays and show you how those bones or joints are supposed to work or fit or move. And then we go over a game plan with you while you're looking at your x-rays so that you understand how it works now and how it's supposed to work so that you feel better. That's the basic MO of most cases in this office. When you're ready, we'll be ready. We make it simple as we can. We make it as easy as possible. We cut to the chase. We find the problem that's causing your symptoms, and then we deliver as best we can a game plan where you understand what we're going to try to do, and then we give you some stuff to do at home. Just like physical therapy, just like the best chiropractic care that you can get. When you're ready, we'll be happy to help you, guide you through this process. And if we can't help you, we'll find someone who can. We'll send you to Beacon or a neuro or the ER, God forbid, if you need it that quickly. But we'll do what it takes to help you the best that we possibly can. Again, Dr. Barry Reed, Mason Spine and Injury Center, Greater Cincinnati. And yes, we do have these, and we are as clean as a whistle in this office, as clean as we can be. Take care of yourself out there, and we're ready for you when you are. Thanks again for taking the time.